Yeah, okay. Welcome everyone to the 46th session of our virtual shadowing program. Tonight we did have a change of plans. Unfortunately, due to an emergency situation, Crystal was not able to join us, but she will be joining us at our rescheduled event next Wednesday at 7 p.m. Central Time. So tonight, Dr. Salazar has graciously joined us and he will be discussing event and VIP medicine. And next slide. And of course, this is our wonderful team composed of myself, Shayon, Taylor, Rachel, Miriam, Alana, Ani, Rohit, Kiana, and our 4 physician coordinators, Dr. Fowler, Dr. Marchetti, Dr. Salazar, and Dr. Reno. And I believe all 4 are on live with us tonight. Next slide. And our upcoming sessions. So next Tuesday will be Specialty Spotlight on Radiology. And like I said before, we have that rescheduled PA Spotlight on Psychiatry. And then the following week, we'll be doing a Specialty Spotlight on GI and Endoscopy. And is this the last slide before? Oh, and of course, the Q&A session, we have 2 of those during the meeting. So if you have any questions throughout the meeting, just put those in the chat and our team will collect those. And we will be sure to ask Dr. Salazar those during those times. And I think Dr. Fowler had a few comments.
Well, welcome everybody, all 300 of you. It's so good to see you. We're so glad to be back on our 46th session. We're at 10 months now with you. We've had about 50,000 unique hits on our website and over 40,000 users that join us. So we hope that means that for you, we are a source of advice, of counseling, of how to help you think about your pre-health career. We think virtual shadowing is an important program. We're trying to decide if we're going to keep going in June, which would begin our 2nd year. And it'll all be up to you. If we hear from you that you want us to keep coming back, we will be here. I want to introduce tonight one of my closest friends on the planet Earth. Gil Salazar is an outstanding clinician, wonderful doctor. He's one of the finest physicians I've ever had the pleasure to know. He is an EMS physician. He specializes in pre-hospital medicine. He trained with us in an EMS fellowship at UT Southwestern. And he is one of the professorial staff of emergency physicians at the University of Texas Southwestern and at Parkland Memorial Hospital. He sees the sickest people in the world. So tonight, would you please join me in welcoming Dr. Gil Salazar? Gil, take it away.
Dr. Fowler, the word professorial is a word, is something that I would use to describe you, sir. So thank you, that means a lot. It's so nice to be here, guys. You know, one of the things that we are very good in emergency medicine is improvising. We are excellent teammates to one another. And whenever things come up and whenever our teammates need us, all they have to do is ask and we'll be there. So no matter where you are in your training, remember that one of the things in healthcare is we are tremendous teammates. And that is the case with the team tonight. So very glad to be here. My name is Gil Salazar. I'm an emergency physician at UT Southwestern Medical Center. I'm also the medical director for Virtual Clinical Observation Program. It's so nice to see all of you tonight. And if I've never met you, it's a pleasure. I wanted to talk about tonight about something that is kind of near and dear to me, because I get 2 main questions all the time. Number one is my background, my virtual background. No, it's actually the real deal. It's actual stone. It's a real fireplace. And so people think all the time that it's a virtual background, but it's the real deal. Whenever it's winter or maybe at the next VCOP session, I'll turn it on for you. The second most common question that I get is, Dr. Salazar, when can I come out with you to work one of the Stars games or go to a concert with you and work the event as an event medicine doctor? Those are the 2 main questions that I get. People often ask me, like, you know, what's the grossest thing you've seen in the emergency department, etc. But it's not even close to my virtual background in my work with the Dallas Stars and the AAC. So tonight I wanted to talk to you a little bit about the road to becoming a sports medicine and VIP medicine physician. I am very fortunate to have learned from the very, very best at UT Southwestern, beginning with Dr. Ray Fowler. I have a lot. I owe him a lot. Dr. Marshall Isaacs, Dr. Paul Pepe. They're pioneers in their own right. And I learned everything there is to know about event medicine and sports medicine from them. So, we train a lot, guys. I've often said that we train until we fail, because when it's really happening, your training really comes into play and you don't want to fail. You really don't think that it's going to happen to you. You're going to be put on the spotlight, and that your training is going to need to come into play at the worst possible moment to a celebrity. Well, it happened to me. On March 10th, 2014, I was enjoying the game as the Dallas Stars team physician for emergency medicine and airway management, enjoying the game. And midway through probably a little closer to the beginning of the first period, the first thing I see is the players on both sides throwing towels on the ice. That's the first time I had ever seen that. And to me, that meant one thing and one thing only. Something bad had happened on the bench. From my vantage point, I couldn't see right off the bat what had happened. But when I paid attention, the first thing I saw was one of my colleagues, Dr. Demeff and Dr. Robertson, pulling what I thought looked like a player into the tunnel. Guys, we had practiced this routine over and over and over again, using mannequins, using standardized patients, actors, knowing where to go, what we're going to do if there is a medical emergency on the ice. You really don't think it's going to happen, but your training kicks in. My training kicked in. The athletic trainers did their job. Dr. Demeff and Dr. Robertson, who were the head team physicians, went ahead and kind of started things. And I went down to the tunnel where they had taken someone. Well, they had closed the doors to give privacy. And when they opened the doors for me, the first thing that I saw were skates. I see somebody on the ground. And my first thought was like, oh my God, there is a player down and somebody is doing CPR on the player. I had no idea who the player was at the time. All I could see was skates. I could see paramedics around them, the athletic trainers, Dr. Demeff and Dr. Robertson. And guys, when I tell you that adrenaline kicks in and your training kicks in, that's when it does. I immediately took control of the scene. I started directing the resuscitation. That is my job as the head physician for emergency services and airway management. And pretty soon I realized that this player was in cardiac arrest. This is Rich Beverly. He was in his early 30s at the time of his cardiac arrest. And to be honest with you, it didn't really hit me that it was PEVs, as we call him, until I got to the head of the bed. They're doing CPR. We're giving him some ventilations. Paramedics arrived with a monitor, and the monitor read ventricular fibrillation, which is a deadly arrhythmia. And what had happened to Rich, he had just come off the ice after a shift, looking okay, all of a sudden slumped over. And guys, when an athlete goes down like that, passes out, you got to think a bad cardiac arrhythmia until proven otherwise. That's exactly what happened to Rich Beverly. As soon as we recognized that this was a deadly rhythm, we delivered one defibrillation. It's a shock to the heart. Rich had his eyes closed, and within 10 seconds of the defibrillation, he started flickering his eyes. I'll never forget when he opened his eyes, he starts kind of looking around. It was like he was confused. He had no idea, but I'll never forget what he said. He said to me, he looks up at me like that, and he goes, what period is it? I go, Rich, it's the first period. Where am I? Rich, you're in the tunnel. And then he said, I'm going to go back on the ice. And he starts getting up. I said, Rich, you may want to just lay back or something. Something had just happened. Give you a few minutes. We're going to explain what happened. Please do lay down. He said, okay, exactly in that tone. Rich Beverly made it through this cardiac arrest, got transported to the hospital, went to the hospital with two of my chief residents at the time. I came back to the arena where I had no idea that they had canceled the game. While Rich was on his way to the hospital, resuscitated and tidied up. This is what I came to see. They were not allowing the players to go back into the tunnel. They had no idea what had happened. And I had never seen the players deflated like this. That's Shane Horkoff on his knees right there. You see Tim Thomas and Jamie Benn, the captain, all the way to your left, number 14. There's Tyler Sagan and Eric Cole. Good guys. I had never seen a group so distraught over having their good friend and teammates. They had no idea what had happened to him. It was up to me and the other team doctors to let them know that Rich had a cardiac arrest and that he had made it, though, that he was on his way to the hospital and things were critical. They threw me into a press conference in front of the world to let everybody know what had happened. And guys, I'm going to share the link at some point with you, and please do enjoy the video. It's kind of funny seeing me putting my training on media relations to the test. So I think I did okay, but kind of the moral of the story is you train a lifetime for this type of situation. And when it happens to you, if you've done your due diligence, then the outcome is going to be phenomenal. Since then, there have been other cases of cardiac arrest in sports, particularly in the National Hockey League. We were pioneers in a sense. Now every hockey team in the National Hockey League has an emergency medicine physician who can handle cardiac emergencies, an airway, as well as orthopedic surgeons, dentists, you name it, we have it. On the line tonight, we have Dr. Brandon Marchetti, who is one of my proteges, also an EMS doc. We trained him ourselves at UT Southwestern, also a paramedic, and actually he is there right now getting tested for COVID-19. He is at the arena. He's going to be working the Stars game tonight. And so he's going to be joining us. Perhaps at some point, Brandon's going to show us his vantage point from his seats, and it's the opportunity of a lifetime. Well, guys, let's discuss a little bit about athletes, the concept of taking care of athletes. What do you need to know? Well, number one, athletes are a completely different animal, a completely different breed. They have none of the needs that a normal person or a normal patient really have. Their body is their job. Their health means their job. Their body and their health means a paycheck for them. And when their body fails them, they run the risk of not being able to make that contract and eventually have to retire and rely on very little or a lot of money that they have made. So they spend their entire careers taking care of their bodies. So their needs are completely different. The things that our athletes are going to be mostly concerned about, number one, is nutrition. They are big into nutrition. And so us as team physicians step into our role of providing professional athletes with the tools that they need to take care of their bodies in terms of nutrition. The National Hockey League, the Dallas Stars, have their own nutritionist on site with all the supplements you can ever imagine. It makes me jealous, and I'm an athlete in my own right, but I can't even come close to the stash of supplements, protein powders, and hydration products that these guys and ladies have. They're phenomenal machines. The second need that athletes have that are much different from ours, they're very, very well in tune with their body. They're rarely going to put themselves in a situation where they're going to get more hurt. They can play hurt, but they're going to be remarkably careful in terms of taking care of musculoskeletal injuries. And so they're in tune. They keep their athletic trainers, they keep their team physicians on board at all times with anything really that's bothering them. And they know when they're not performing at their best. So those two things are going to be the main things that athletes are concerned about. Now, there is a third aspect, guys, that has become a lot more important for athletes, and that's their mental health. The concerns about chronic traumatic brain injury and encephalopathy are the real deal amongst athletes, and the mental health implications of things like CTE and other traumatic brain disorders in athletes, they're absolutely catastrophic. So athletes are getting more and more in tune with their mental health. They're taking care of their body, they're taking care of their mind, and us as team physicians are actively looking for ways to give them the tools to take care of their mental health. All right, so what happens when athletes, when things go wrong? This is Nikita Sherbak. He is a Texas Stars forward. The Texas Stars are the AHL. They're the junior affiliate for the Dallas Stars. And this is Nikita. Took a nasty skate injury to the mouth. And well, Nikita just kept playing, put a towel when the trainer came out on the ice, and he went right back to the locker room for some repairs, as it's colloquially known. Well, his exact words were, "This is a face that only a mom could love," and to some degree, he's absolutely right. This is a nasty injury. If you notice his inferior, his bottom lip, it's completely disrupted all the way down, all to the corner. There is muscle, there is fat, there are salivary glands, and even nerves that are affected. So basically what we do for this type of injury, we work with oral and maxillofacial surgeons on site to do a basic closure of the wounds. And then Nikita was taken to the operating room for a kind of a washout, debridement, and official closure. And because of the great care that he received by the doctors down in Round Rock, Texas, this is what Nikita looks like today. He did lose a tooth or two. That's a very common injury amongst NHL players, but these guys are tough as nails. So don't worry. His wife is still loves him very much. His daughter still loves him very much. And he is now playing again at an elite level. So try not to catch any skates on the mouth, guys. Dr. Marchetti, are you able to tell us briefly about what happened last Sunday related to skates?
Yeah, can y'all hear me okay? Okay. Yeah, in the game last Sunday, just a few days ago, first period, during the scuffle to score the first goal of the period for the team, for the Stars, one of the players who got the assist ended up taking a skate blunt force to the underside of his jaw and chin. Luckily, there was no slice or cutting effect. It was just a blunt injury. It could have resulted in a laceration to the neck, the airway, the windpipe trachea, even worse, carotid artery. That would have been a bloody hot mess. If y'all want to have nightmares, feel free to YouTube anything about arterial injuries in hockey. There's some really gnarly goalie injuries. We call that a 10 out of 10 pucker factor. When that happened, all the doctors sitting on the bench saw that happen and all cringed simultaneously. And then he, in true hockey player fashion, just kind of shrugged it off like, no big deal. We scored. Well, let's move on. We dodged a bullet.
And guys, that is exactly why Dr. Marchetti is there. Should a catastrophic airway or cardiac emergency happen, that's why Dr. Marchetti is there. That's why I go when it's my turn to go. So if you guys want to be in our shoes one day, because one day we'll retire, you guys are it. It's a good thing you're joining us tonight. All right. So here's lesson number 2 for the day. Now that you know what athletes care about, how they're different from us, what their concerns, what their priorities are, here's the perspective from us as emergency medicine physicians, sports medicine docs, and VIP medicine physicians. The goal is to be as discreet as we possibly can and provide world-class medical care. That's how I summarize our mission. You train a lifetime for things, and you're all going to be phenomenal healthcare workers, physicians, PA, nurses, and you guys are going to do a great job. But one thing that is very different for athletes is they value their privacy. As public as some of these injuries have been, athletes are relatively shy when it comes to their own personal health, when it comes to their injuries. They want to make sure that their public views them as kind of valuable members of sports society, and so they tend to be very discreet with their injuries and with their medical care and with their medical conditions. And trust us, there are hockey players, for example, with diabetes, others with high blood pressure. We even have hockey players that have had cardiac disease in the past. We've had deaf hockey players, but they're very discreet about these things. So our goal is to always take care of them. At the end of the day, they're human beings. They have different personalities, but they're human beings who deserve the best care in the world. But we give them complete privacy. And by the way, everything that we share tonight is fully and open, accessible to the public. I may be telling a story or two that's de-identified. But do please know that the goal for us is to give them world-class care and keep that confidential. So let's have a little fun with trivia. So what is going to be the most medical condition that athletes suffer during a live event? All right. So are we dealing with volume depletion, which is called dehydration? Are we dealing with musculoskeletal injuries? Okay. Or are we dealing with cardiac emergencies? What do you guys think is going to be the most common? Put them in the chat, and Ms. Reagan, I can't see the chat too well, so tell me what letters they're going for.
Looks like A and B. It looks like mostly B though.
Mostly B? Yeah. See, you guys are very, very smart. That's why I love coming to these sessions. Yeah, absolutely. Musculoskeletal injuries are the name of the game. Let's talk about this specific injury. This is Stefan Robidoux. He is a Canadian hockey player, French Canadian, defenseman number 2. And he went down hard on the boards. He tripped or caught a skate through somebody. And you know that when you're skating, you have huge momentum and you fall, it's very hard to stop yourself. Well, he went leg first onto the boards, and you can YouTube this. This is freely available too. He had a gnarly tibia and fibula fracture, both of them. He went down on the ice, and it's not very often that the trainers need us, the physicians on the ice. But when you see a trainer on the ice going like this, you know it's something significant. That's one of those times as that one of us had to go down there. That's Dr. Alex Seisman, dead smack in the middle, kind of closest to the glass. Very well known to me, Dr. Marchetti, Dr. Fowler, good friend of ours, EMS doc, trauma surgeon. He was one of the docs there that night. Right behind him is Dr. Demef, who is the head physician for the Dallas Stars. He is a family medicine physician who is trained in sports medicine. And the guy with the brown suit who's bald, that's Dr. Bill Robertson. He is an orthopedic surgeon, back specialist. He is the other head team physician for the Dallas Stars. So it's not very often that we get to go on the ice to take care of folks, but Stefan had a catastrophic injury that necessitated us taking him to the hospital. He needed an operation. He even had what's called a fasciotomy, where we actually have to open his tibial compartment because there's so much swelling as a result of that injury that it had to be sliced open, and he missed approximately half a year. Absolutely catastrophic injury, but like I was talking about, these guys get world-class care. One of the things that you have to note is that these players tend to suffer these injuries in front of the world, and you can see various reactions from the lady all the way to the left trying to take pictures, which is not very nice, and all the way to the right, a visiting fan from the Chicago Blackhawks. Her face tells you everything you need to know about how gnarly this injury was. So remember, these are absolutely painful injuries, and Stefan, he did quite well, eventually retired, and is now a valuable member of the coaching staff for other teams. So as part of your training to become a sports medicine physician and a VIP medicine physician, I would say that the number one piece of advice that I have for you is your relationship with the athletic trainers. The athletic trainers are there day in and day out. Their job is to take care of the patients much like we would, but they're on a much closer level to the players than even we are. They know them by name, they text each other, and the players go to the athletic trainers for absolutely everything. And I mean absolutely everything from, hey, Dave's Eyes is the head athletic trainer for the Dallas Stars. Dave, I've had a pain on my wrist, all the way to Dave, I need you to check something down there that doesn't feel quite right. Uh, the athletic trainers see it all. And so when I'm teaching others how to do event medicine for a living and they're interested in it, the first thing I tell them, guys, is become buddy with the athletic trainers. Earn their trust because they've been around the block. They know what it's like to be in the arena with the players. They know the players even better than you do. They know their injuries even better than you do on a day-to-day basis. They work with them. They progress with them on their physical therapy, etc. And guys, the athletic trainers are the ones that we train with the most. Here are athletic trainers for teams working with EMS and medical directors on how we backboard a patient. Just like you saw the picture with Stefan, that is a very well coordinated approach when we need to get a player off the ice. So always be nice to your athletic trainers if you are interested in doing that. At some point, most of our residents in emergency medicine, family medicine, for example, are eligible to work with local teams. And one of the first things that we do is we integrate them into the athletic trainer family. Okay. Now, sports medicine is phenomenal. To become a sports medicine physician, you do medical school, you go through residency, and there are some residencies that have almost direct paths so that you can do a sports medicine fellowship. Emergency medicine is one, orthopedics, family medicine is another one. And the majority of us do either sports medicine or EMS fellowships in order to be able to provide this additional level of care to this very atypical, very unusual type of patient population. So Dr. Marchetti and I went the EMS route, but we have other colleagues that went the sports medicine fellowship route. What's very cool about the route that Dr. Marchetti and I took is that we are also able to take care of celebrities, okay, and VIPs. So Dr. Marchetti and I have the opportunity to go attend live events and serve as on-site physicians for VIPs. Dr. Marchetti and I have done work for the government as well, for politicians, governors, presidential candidates, etc. So one of the big advantages of being EMS trained is we get the opportunity to work with a very unusual type of clientele. So let's talk about celebrities really briefly. So what do you guys think is going to be the most common type of condition that celebrities suffer during an event? Are they skin and ENT, ear, nose, and throat type deals? Or is it pre-existing condition? You know, a lot of these celebrities, they're not the healthiest folks on earth. They drink a lot, they smoke a lot. A lot of them have substance use disorders, and they still have other things like diabetes, hypertension, etc. And sometimes major trauma. We have seen that before, major burns. So, Reagan, what are folks saying in the chat about their choices?
Looks like just about everyone is picking B, pre-existing conditions.
That's a phenomenal guess right there, guys. It's actually, believe it or not, it's going to be mostly ear, nose, and throat and skin emergencies. Okay. Laryngitis. That's one of the most common things that us as event medicine physicians are asked to see VIPs about. It's like, I'm about to go do a show right now and I have a tickle on my throat. And just like athletes rely on their body for making a paycheck and for impressing a crowd and for longevity, singers particularly rely on their voice. So we're often asked to see celebrities and VIPs for ear, nose, and throat emergencies. Other things that celebrities are concerned about, they're also concerned about their health. So vividly remember in the past, folks like ourselves have been asked to see if we can, give like B12 vitamin shots, for example, to celebrities, that type of deal. But you guys are absolutely right. We are also asked to see celebrities who are diabetics. Their sugar may be running a little bit high during the show. How do we manage them? Okay. How do we manage their medications? A lot of them travel with their own physician sometimes, or have their own physician available 24/7. So we coordinate a lot of care with them. And we have hospitals designated to take these celebrities should a medical emergency happen. I had the pleasure, since it's been so many years, it's fully went to past HIPAA days. I had one of the biggest encounters, most notorious encounters I ever had was Roberto Duran, who was a boxer for many years in the 80s and 90s, absolutely well known. And he came to our emergency department to seek care for an orthopedic injury. Guys, I had only seen Roberto Duran during on TV and boxing. And it was the pleasure of a lifetime to be able to meet and treat somebody that you admired as a child. So most of you are maybe a little bit on the younger side to know who that is, but for people like me, that was a pleasure. Now, I will tell you a brief story about where my VIP and event medicine training, to the heights it took me. Some of you may know that story. If you do, forgive me, but it's well worth. It still brings a tear to my eyes sometimes. In 2013, I had the pleasure of meeting one of my idols, Eddie Vedder, who is the man right there. He is the lead singer for Pearl Jam. I have followed Pearl Jam for over 25 years. Amazing group, really touched me in terms of inspiration, okay, musically, even through tough times in my life. Well, Pearl Jam was there for me. In 2013, Pearl Jam was coming to play at the American Airlines Center. I was already an EMS faculty, training VIP medicine, and my boss at the time and dear friend to me, Dr. Marchetti and Dr. Fowler, Dr. Paul Pepe, was the medical director of the American Airlines Center at the time. Several months before the concert, I told Paul Pepe, sir, I would like to go work the Pearl Jam gig with you. And I would like you, sir, I've never asked for anything in my life. I need you to take me backstage and make sure that I'm right there with the band when they arrive. Paul Pepe said, okay, I can do that. Yes, you never asked for anything, Gil. Let's make it happen. Well, sure enough, the day of the concert arrives. I don my nice suit, my tie, as every good event medicine doc would. And Dr. Pepe and I went down to the tunnel to security, got our clearance, our all access badge. And I'll never forget, I am backstage and Pearl Jam is doing sound check. And I don't go to the floor. I don't want to interrupt. That's a very, very private moment for the singers in the band. So I didn't want to interrupt. Sound check ended. I saw Stone Gosser, the guitarist, Mike McCready, walking toward the dressing room. Matt Cameron, the drummer, Jeff Amon, the bassist, went in a separate direction. And all of a sudden, I see the man, the legend, Eddie Vedder, my idol, approach me, Dr. Pepe, and his first words were, how you doing? Guys, I could have died. I could have died right there. That was my brush with fame right there. Guys, just please direct your attention there, Dr. Marchetti's screen right there. That is the players right there exiting. That's the locker room there to the right. He is going to go into the tunnel now. Guys, that is the tunnel where we take care of patients when they go in cardiac arrest. That is the exact tunnel where we took care of Rich Beverly. And you see those doors, we keep them closed just in case of a medical emergency. And Brendan's going to go up the stairs right there to begin the game. So This is an amazing opportunity. Now Brandon's going to go to his seat shortly. I'm sure he'll give us an update. All right, guys, let me take a quick swig of my water, and we'll discuss the next one. We discussed brain injury, head injuries before. This injury is the one that set the stage for a big time change in the way head injuries were looked at in the National Hockey League. A lot of players in the National Football League and boxing and other high contact sports were very notorious for former players coming out with things like traumatic brain injury, mental health concerns. But the NHL was lagging a little bit behind until Steve Moore. Steve Moore of the Colorado Avalanche took a nasty sucker punch by Todd Bertuzzi many years back. Steve Moore went directly down on the ice, suffered a significant head injury. Steve Moore was never the same after that. It was because of Steve Moore and his catastrophic injury that the National Hockey League made a lot of changes to the way head injuries were looked at, protocols in terms of what things were going to be penalized during the game, and the etiquette. Players started recognizing, wow, you know what? I played many years ago, and now I'm having things like really bad headaches every day. My vision has never been the same. Yes, and head injuries and traumatic brain injury amongst athletes is the real deal. So us emergency physicians, sports medicine enthusiasts, and event medicine doctors take really good care of our players. The protocols for assessing players who have gone down on the ice after an injury like this are very, very, very tight. If we even smell or suspect that a player has had an injury like this, we got to pull them off the ice and do some neurological testing outside. We even have a third party neurology consultant who assesses the patient so that there is no bias whatsoever, and the athlete does not come back on the ice until they're absolutely cleared. Guys, and it's the real deal. These players walk around with terrible headaches. Sometimes we mentioned the nausea, forgetfulness, amnesia, and that's a problem that we're trying to curb day in and day out. So for you, future event medicine doctors and sports medicine doctors, and healthcare workers, let's take care of our players' mental health and their brain as well. Let's work hard with technology, with companies who develop equipment, special equipment to prevent this type of injury. So we've optimized protection for the player's head in terms of visor, helmets, and safety equipment. And of course, the National Hockey League is fully behind the concept of taking care of athletes while they're still playing. Okay, guys, I am having a lot of fun with you guys. Let's see what kind of questions you'll have, and then we'll see if Dr. Marchetti can give us an update from his tremendous seats at the American Airlines Center. So Reagan, what do we got?
So first off, the students want to know how you even got involved with the hockey team. Did they contact you? Did you apply there? How did that all come about?
A player named Mike Ribeiro, number 63 for the Dallas Stars in the late 90s and early 2000s, suffered a significant neck injury during the game. He developed swelling right around the trachea, necessitating basically a tracheotomy, in which a surgical incision is made onto the neck and into the trachea, the windpipe, to provide the patient with air, ventilation, and oxygen, because you cannot obtain an airway by any other means. It was around that time in the 2000s, early 2000s, that the concept of having dedicated physicians on site at every game began to be a thing. It wasn't adopted until around 2012. That was the year when the Dallas Stars approached us at UT Southwestern to look at a way of taking care of the patients. Before I move on, guys, there's just enjoy the view for just 2 seconds. Dr. Marchetti is sitting right there in section 119. It's absolutely phenomenal. He is sitting right behind the players bench. You see that nobody else is allowed behind the players, but we have quick access to them in the tunnel should anything happen. There is the entrance to the tunnel right there. So all Brandon would have to do is just run right quick and he would be able to see everything that happens. Sitting next to him are some of the other docs. That looks like that's Dr. Demef right there, whom you saw in the picture earlier. And Dr. Demef is a dear friend. So how do we get into this business? So yeah, UT Southwestern was approached about providing these services for the Dallas Stars. The university hired a team of physicians who determined who were the best candidates to be on site at every game. And I was very fortunate to be chosen as one of the physicians to go do that because of my training in EMS, emergency medicine, airway management, and cardiac arrest, and evad medicine. It's an opportunity of a lifetime. They treat us remarkably well. And, you know, even though you don't think anything bad's going to happen, we're always prepared. So that's how we got started.
Somebody just asked, do you actually get to enjoy the game whenever you're there?
We have a blast. They feed us. We get to park down where the players park. We have no issues getting in or getting out. We go through the special entrance, they give us whatever we need in terms of hydration. They even have a tray for us ready to rock and roll, and we got the best seats in the house. And so that is a small token of appreciation from the team to us in exchange for the services that we provide. And we will not discuss financial compensation at this time. We do enjoy the game.
Okay, so how do you handle the pressure being the one audiences or teams are looking for when there are some injuries that people don't/can't come back from? For example, they said a horse slashing injury or random heart attacks.
You know, we are in the business of saving people's lives, and we are in the business of being in people's lives at some of the worst times in their lives. And emotionally, you accept that, you embrace that. And part of your physician athlete patient relationship is accepting the fact that this current injury, this current event may be the last time that the player is going to step foot on the ice. That was the same with Rich Beverly. He never set foot on the ice again adverse cardiac arrest. And that's something that hurt a lot. It hurt Rich. It hurt me. But it's part of life. And we commiserated together. We remain good friends to the day. And now we've spent a lifetime. This is part of my outreach. Telling you this story is my giving back to Rich and to the community to inspire others to be like us. And on his end, Rich has started his foundation, which helps teams and facilities have defibrillators on site. And because of programs like Rich Beverly's all around the world, there's been actual saves because now there are defibrillators in every arena. So it's part of the job. You embrace it. It sucks. It hurts. But it's a very special patient and physician relationship that you develop. That's how I handle it.
Do you know if PAs are able to do this as well?
Yes. Physician assistants are part of the care team. And I know as a matter of fact that they work directly with the athletes, particularly on the outpatient setting. And they augment the care that the physicians provide on site. It's a multidisciplinary team. We have massage therapists, for example. We have x-ray technicians available on site. So there's quite a bit of allied health specialties and disciplines that also participate in the care of these patients, and physician assistants, absolutely. And they go through the same training that we do.
Gotcha. And so are you responsible for helping spectators as well who have medical emergencies, or just the players?
You know, it's a little bit funny how that works. It really depends on the relationship and the contractual arrangement you have with the team or with the arena. Our contractual relationship with the team for the Dallas Stars is to take care of the players and coaches, though we are available to assist Dallas Fire Rescue, who provides on-scene care for everybody else. So, though our main priority when we're there are the players and the coaches, if one of our paramedics in one of the 8 stations needs help with a patient, particularly a very high-risk situation, a cardiac arrest, of course, absolutely, we'll do everything that we can to help.
And you mentioned that you train and train and train with mannequins and actors, but how do you approach critical situations that are nothing like the ones that you trained for?
You know, the training, I would say that the training of actually doing patient care in the hospital is a lot tougher than a situation like we had with Rich Beverly. And what I mean by that is, with Rich Beverly, what we had to do was provide the very basics. When you're in the hospital, you are responsible for every single aspect of patient care from the moment of arrival until they go up to the floor. With the athletes, I have a kind of a limited amount of time before I need to get them to the hospital. And so my responsibility is actually smaller. The scope is actually smaller. It's a much kind of more narrow scope of practice that I have, which makes things a little bit simpler. So when I arrived on scene and Rich Beverly was getting chest compressions and being defibrillated, to me, that was the most basic of things, as opposed to when you're in the hospital and there's a cardiac arrest, plus somebody's vomiting blood, plus I'm responsible for 20 other people in the pod and I have phone calls, etc. My focus is very, very narrow with the team, and that allows me to handle the pressure much better.
Wonderful. And I think this will be our last question before I move on. So the students were very curious to know what caused the cardiac arrest in such a young individual, and they maybe thought excessive caffeine consumption or other supplementation, if you know.
Yeah, no, we have some idea. Rich had a condition called atrial fibrillation. It's an abnormal rhythm of the heart that was detected on an EKG, on a screening EKG. He was having no symptoms whatsoever, but as a result of more aggressive screening measures, an electrocardiogram is part of the routine, and we detected atrial fibrillation in Rich Beverly. He was started on a medication. I will not mention the name, but some of these medications are known to very rarely lead to things like ventricular fibrillation, ventricular tachycardia. Could that have been the cause? Maybe, but the students are absolutely right. You guys are really smart, man. Things like caffeine, some supplements, some of the banned substances can lead to that. Steroids, for example. Now, the professional teams are very, very tough on the athletes when it comes to performance enhancing drugs. So it's very unlikely that performance enhancing drugs or PEDs had anything to do with Rich's cardiac arrest. But yeah, just like you're a detective in the hospital, you're also a detective when you're working with the team. So with Rich, it might have been his atrial fibrillation.
Perfect. Well, that will conclude our first Q&A, so you are welcome to continue.
Outstanding. Thank you so much for your questions. That is me right there in the tunnel. Dr. Marchetti led you up the tunnel a little bit ago. And right on my right there is where we keep our emergency equipment. And you see how close it is to the ice, so that in case something happens on the ice, we try to get the patient, the athlete, off the ice as quick as possible. They can develop hypothermia very quickly. Okay, and so one of our main priorities is to get him out of the ice as soon as possible, lead him into the tunnel, and start resuscitation. That's a little bit different from what you normally do in patients, but remember that how we talked about, this is a much different environment. The last thing that we want to do is to make an injury or a cardiac arrest be such a public thing in front of so many people. So we've designed a mechanism to get the patients off the ice very, very quickly and get them the care that they need, especially emergency care. So a while back on my Instagram account, I put a picture of the actual Dallas Stars tackle box that we have. And that has everything you could ever dream of. But for those of you enthusiasts, you may want to go and do some volunteering at a high school game, for example, as a team medic or a volunteer. These are a couple of things that you might need. Okay. A radio or a way of communicating with paramedics, EMTs, or 911 is absolutely mandatory. That was one of the biggest lessons Paul Pepe told me, is how to work a radio. It seems like you should be very familiar with a radio, but until you actually play with one and you play with channels and you know what channel is going to be receiving on the other end, it can actually be a tough concept. 2, bleeding control. In my go bag, I always carry bandaging. I always carry my shears to cut through clothing. I carry my tourniquet, which is right there in the middle. And I carry things like hemostatic bandages that are impregnated with hemostatic agents so that I can take care of a bleeding wound. And this is a very important concept when it comes to hockey players, particularly those skates. They're blunt on the bottom. They're actually superbly sharp on the sides. And I have been involved in caring for multiple patients over the years who've had skate injuries on their extremities. None of them have actually needed a tourniquet that I've ever had to put on them, but I'm always ready because these injuries can be absolutely catastrophic, limb-threatening for the athletes. Next, I always carry some basic airway equipment. I try to have a kit that's very portable with some basic airway equipment so that I can fully take that to the patient and start some ventilation and oxygenation, basically until the paramedics arrive with bigger equipment. Our box for the Dallas Stars has advanced airway management equipment. So endotracheal tubes. We even have a way of creating a surgical airway if we need to. In part of Dr. Marchetti's and my responsibility when we arrive at your arenas, make sure that that box is available and fully stocked at all times with all the drugs that we need in case we need to take care of a patient. And of course, as we mentioned, the athletic trainers are part of that training that we do. They know how we work. And even more awesome, we have Dallas Fire Rescue paramedics on site during every part of the game to assist with further care of the patient. So, but these are just the basics to get you through a bad day. And the last thing, guys, that you're actually going to be asked about the players, they're always having some aches and pains. So I always carry some oral pain medications, some Motrin and Tylenol. I carry bandages, splints, that kind of deal for basic care. I carry some blankets just in case we need to keep the patient warm. So you will be amazed how simple your go bag can be and how some very simple maneuvers can get you through a really, really tough day. Now, guys, I do not like going on the ice. I do not like going on the ice. You have your dress shoes, and none of us team physicians carry the special shoes that the trainers do to walk on the ice. They don't need us there. If they need us, it's because they absolutely need us. That's Patrick Eves right there. One of the best guys I've ever met. So kind, generous, humble. Wore number 18. He was a forward for a number of years. Patrick caught a puck right on the right cheek. Okay. I have never seen a player go down that hard on the ice face first after any kind of injury. I saw the puck fly and I did not see where Patrick got struck. I do remember seeing his head go like this. I thought it had caught the helmet, to be honest with you. But the moment he hit the ice hard, I knew that it had not hit the helmet. It hit him directly in the face. That was one of those come here times by Dave's eyes. You see Dr. Demef right there. You see Dr. Robertson, and that's Dave's eyes right in front of me. That was one of those times where he called the three of us because we had no idea if Patrick was breathing. We had no idea if he had gone into cardiac arrest. We knew nothing. And I'll tell you what, that was one of the first times I ever did have to go on the ice. And the players and the referees are actually superbly kind in helping us through, because that ice is no joke. And trust me, I did not want to fall in front of 14,000 fans and national television. That would have been pretty embarrassing. So I was helped on the ice by the referees, and that continues to be the case. This was a time where I actually had the opportunity to go with Patrick. He was in so much pain that we had trouble managing it with our basic medications on site. I requested Patrick be transported. And actually, since we had an extra doctor that night, I rode with Patrick on the ambulance all the way to Clements University Hospital at UT Southwestern, where he received great care by a colleague of ours, Pat Brown, whom Ray and Dr. Marchetti know. And Patrick, thankfully, went through a big workup, didn't have anything, but was walking around with one of the nastiest hematomas I've ever seen on his maxilla. You could actually see it right there in the picture if you pay close attention on his right cheek. He started developing a hematoma as soon as the puck hit him. I had never seen an injury like that. Hope I never see it again. The amount of pain he was in, and these guys are tough as nails, guys. I don't ever want to see that again, but I'm glad that we were there for Patrick. Now, we mentioned a little bit about kind of what we do with VIP medicine. One of the things that we're awesome about as well is helping venues coordinate much larger events like concerts. So we take care of athletes, we take care of VIPs, but occasionally we're also asked to participate in large events, okay, like parades. Like when the Dallas Mavericks won the 2011 championship, we were part of the planning team to take care of the thousands of people that were going to be on the streets in the middle of the summer. So when you are asked as an event medicine physician, what are the important things in the planning of these things, a couple of things come to mind. Number one is the weather. Guys, it's all about the weather. And I already know that if an event is going to be in the summer, I know exactly what I'm going to be expecting from my patients. I'm going to go see a lot of people falling down. I'm going to go see a lot of people who are intoxicated. I'm going to go see a lot of dehydration. I'm going to be seeing a lot of people with heat-related emergencies. And so part of the planning process with your entire team is going to prepare for a weather-related issue. Winter, completely different spectrum in which patients tend to suffer from things like hypothermia, especially if they have been drinking. And patients with hypothermia tend to have significant cardiac abnormalities, arrhythmias, dysrhythmias, etc. So the weather is a big factor in what we do. Does anybody know what this venue is? Put it in the chat, and then Reagan will let me know if the students guess correctly what it is. Second is the crowd demographics. I already know that depending on the concert, who's going to be playing, I know exactly what the medics are going to need to be preparing. If it's an older crowd, I know I'm going to have a lot more cardiovascular types of emergencies, some diabetic emergencies, a lot of things like fatigue, for example, and I better get ready for worst case scenario like myocardial infarctions. If it's a younger crowd, for example, I know that I'm going to be dealing with some substances in there, some illicit. I'm going to be ready for things like seizures. For example, cardiac arrest is always something we prepare for, but the younger crowd tends to go for more agitation, more substances, more seizures, and got to get them out of there. Location is next. It is a lot harder to plan an event that is wide open like this one. Did the students guess what venue this is, Reagan?
Yeah, so most of them said Coachella, and one
Yes.
person thought that it was the Texas State Fair.
Yes, I like that guess. It's actually Coachella. Yeah, absolutely. Great venue. If you've never been, you absolutely have to. So this is a nightmare of an event to plan. All right. It's a lot more wide open. There may be some boundaries, but for the most part, people can scatter everywhere. And how you locate your teams, where your paramedics are going to be, where the aid stations, it's a logistical challenge. And last but not least, the type of event. I know that if I'm going to a concert such as Slipknot, and by the way, I did attend that show and it was great. I love it. My brothers took me to it. I know that I'm going to be dealing with a certain type of crowd versus sporting events, which tend to be a little more mellow depending on the sport. And I know that if it's going to be like a comedy show, for example, I can expect certain things. So the type of event really matters. But music, guys, influences for sure with 100% certainty. Music influences the types of emergencies I'm going to be seeing. All right. Now, you would think that you as a spectator physician, you're gonna take the night off. Nope, of course not. We were a couple of rows back with Slipknot when all of a sudden they stopped the show, and Corey Taylor starts saying, he stopped the show and starts pointing down at the pit, and everybody starts making way. So what do you guys do? You're a physician. You got the training. Do you go or do you not go? You're a spectator trying to have a good time. I decided I was going to go. So this poor young man had what looked like a seizure, woke up very quickly. Paramedics, actually, there were EMTs, came in with a wheelchair. He was awake and alert at the time, wheeled him out to the care station, and the show was able to resume. So I pretty much know the type of music is going to influence the type of emergencies that we're going to see. And remember that age has to deal a lot with it, the type of location, the type of venue. And please always be aware that these rock shows are going to bring a unique challenge to any event medicine physician. All right. Now, back to sports. I love VIP medicine. I love music, but I breathe and sleep hockey all the time. This is one of the most notorious injuries of all time, and I'm going to let that play as many times as you'd like, because this is Clint Malarchuk of the Buffalo Sabres. He suffered one of the most devastating, scariest injuries in all of sports. In my opinion, probably the worst of all time. He caught a skate directly on the neck, and you can see right off the bat grabbing his neck, and you can see spurts of arterial blood making their way onto the ice. This was an absolutely devastating injury. And guys, this were not the days where they were going to have a team physician with airway management equipment readily available. And thankfully, Clint did okay after this. But you can only imagine, if you've never watched a YouTube video, please do. The athletic trainers coming in with towels, doing everything they possibly could to stop the bleeding before taking Clint off the ice. Guys, if that had happened on the ice, that's going to be one of those come here type of events. I'm going to ask for the stretcher right away. I'm going to grab my airway equipment, and I'm going to get that patient off the ice as quickly as I can and do some airway management in the tunnel. I'm going to be holding pressure as much as I can. I'm not going to be doing any maneuvers on the ice, just because the last thing I want is to be on cold ice, leaving the patient hypothermic without the equipment that I need. And I really need to get that patient out of there and into the hospital as soon as possible. So this to me was the injury that changed the ball game in terms of airway management for us. And I studied this injury over and over again so that we're ready for it. I'm glad Dr. Morchetti did not have to handle that the other day. That would have been horrendous. All right, guys, that's been a lot of fun. Can't believe it went that quick. It's 8:04. So y'all that work with me at VCOP know that I'm very big into punctuality. And guys, the reason I do that is because in a couple of years from now, you are going to be directly responsible for patients, and your patients and your team depend on it. And so I always like to start on time and finish right on time. That being said, I'm leaving plenty of time for questions and answers. I'm so glad that I was invited. I'm going to make a quick plug for VCOP there at the end, but I'm going to leave my IG there where I post cool pictures of what I do on a day-to-day basis. Sometimes I have giveaways and I announce updates on VCOP. So, all right. I want to hear y'all's question. You guys have been great, and I'm so grateful.
Gil, this is Ray. Is there a best specialty to become a team doc? Orthopedics, emergency medicine? You mentioned family medicine,
Yes,
but
sir.
the family medicine doc had done a sports medicine fellowship. What's your thought about this?
The spectrum of care that particularly athletes receive, they rely on that multidisciplinary approach, Ray. I think Dr. Robertson, an orthopedic surgeon, is going to have the continuity with the players because he's the one that coordinates the surgical correction to many of the injuries that they have, both during the season and off season. So when we are having camp, for example, right around September, he is following up on all the players who had their surgeries during the summer. Now, I have my specific role within the organization, and I love airway. I love cardiac arrest. That is my niche, and that's because a team has me. But I'm going to tell you what, Dr. Demeff, family medicine doc, is a special guy. He develops a connection with the players that I can't ever reach, that Robertson can ever reach. He just has that touch. He's fatherly. He is kind. He is complete. He's got a wide focus, and the players absolutely adore him. So I'm kind of narrow-minded. Robertson is an orthopedic surgeon, and his mind, he is very methodical, but the Meth, he is like a darling. So you can't go wrong. The players get a little bit of everything, but man, you can't go wrong with family medicine, for example.
So Gil, when you do an event like this, is this the only thing you do in the day, or will you go work a day shift in the ER and then go do an event?
Yeah, part of folks ask me fairly frequently what a day looks like for me, and my work doesn't stop. Doesn't start actually when I go to the game. I would have more than likely, unless it's a weekend, I would have put in a full academic or clinical day and then go to the arena. The game was a 7:30 start, and Brandon and I get there at least an hour early to get tested for COVID-19. That way we can be in the green area. And you can see that Brandon's in front of the glass right there. We got a partition between us and the fans. So it's a long day, and we stay there until really the doors have closed. The athletes are kind of tucked away, and you're getting home around midnight. It's like a regular shift, except that you've already worked a full day already.
Gil, do you carry medical equipment in your own car?
I do. My Go Kit contains bleeding equipment, mostly including a tourniquet and hemostatic bandaging and basic oral airways. And I carry my own supply of Motrin Tylenol for myself or for anybody who needs it. But my bleeding control kit is top notch, and I have no problem spending on updating it every so often. I'm very proud of my Raptor shears that can cut through anything, including seat belts. Oh, and I'm able to break car windows as well.
Gil, you mentioned a sports medicine fellowship. I mean, there's actually formal training in being a sports doc?
That is correct. We have faculty at UT Southwestern who does that. Dr. Dustin Harris, who, by the way, if you don't follow on Instagram, please do. Man, that guy's amazing. And now he's growing his TikTok, his personality there. It's pretty amazing. So folks like Dustin Harris spend a lot of time in fellowship, at least a year, and they can become board certified in sports medicine to do what I do. But their biggest focus is going to be not just kind of the on-site care for the patient and the athletes. They develop relationships with them in clinic, in the operating room, and during the game afterwards. So it's a more complete, more wholesome, I would say, approach to things, whereas mine is very, very narrow.
Reagan, take it away with the QA.
All right, let's see. So does the away team have their own staff, or do you support both teams?
We, as the home team, are responsible physician-wise for the care of both home team and away team. So it's not unusual for the away team to have medical needs requiring a physician, and we do it with courtesy and professionalism. And I'll tell you what, I'm very biased, but I think NHL players are some of the kindest, most down to earth of the athletes I've had the pleasure of taking care of. And I'll never forget one situation. One of the Arizona Coyotes stars, he's a defenseman. He may or may not wear number 23. Look him up. He was having bad, horrendous gastrointestinal symptoms one night. Came off the ice just puking his guts out. The athletic trainer for our team came up to me and he said, "Hey man, we call each other man, by the way. It's very, very informal. That's how tight we are with the athletic trainers." He said, the Coyotes athletic trainer is pretty worried about 23, can't get ahead of the vomiting. Can you go take a peek at him? No problem. Go into the visitors locker room. I shook his hand. It took a little bit of a medical history, examined him, and we were able to get him some IV fluids, some nausea medication, and just the gratefulness for that player who later on reached out personally to thank us for the care was remarkable. So yeah, absolutely. We do that for small things. We've done shoulder reductions when they dislocate shoulders for the other team. Anything the other team needs, we're there for them and their coaches.
That's awesome. That's super good to know. So is there a go bag or at home bag you would recommend for every lay person to have available and prepared at home?
Yes, absolutely. If you have a pen, write it down. Okay. You're going to need some bandaging to be able to stuff a wound that keeps bleeding and bleeding and bleeding. Okay. Some basic gauze. 2, you need to learn how to use a tourniquet. If you don't know how to use a tourniquet, please Google it. Buy the good one. All right. The CAT, C-A-T.
I gotta put my mask on.
Hey, here's Dr. Mev. How are you, sir?
He's asking, how are you?
Good to see you. I'm telling you, man.
He asked, is Fowler wearing clothes? He looks naked there.
Oh, Dr. DeMeff. I'm telling you, the collegiality and professionalism and friendship with these guys is phenomenal. You need to learn how to use a tourniquet, a combat application tourniquet or CAT tourniquet is the real deal. Please get you one of those. You got to get you a good pair of trauma shears so you can cut through clothes. And last but not least, some good old tape to be able to tape up the gauze once you wrap it around the wound. If you can get through a bad bleed, you're okay. In my personal vehicle, I carry some airway stuff. I have my Raptor shears to be able to cut through clothes and seat belts. And the thing that not a lot of people think about is how to break a window and a fire extinguisher. I'm sure Dr. Marchetti carries all of those plus other goodies since he's a police officer as well. So I envy his go bag. By the way,
I've got a full intubation kit, all kinds of medications I carry with me, over a dozen tourniquets. We're ready for active shooters and all kinds of badness.
He's an amazing man.
So Gil, a question just popped up about the active shooter, and Brandon, you might listen in. With this, what seems to be increase of active shooter events, is that changing how y'all are approaching event medicine?
100% yes. 100% yes. For example, one of the things that I've done now when I go to events, and now I just carry it in the car. I have my own go bag, but I have I purchased a cache of several tourniquets. I have at least 12 that I carry with me at all times. The arena has its own preparation and procedures for active shooter. Now security is superbly tight. You are going to get a sniffing dog under your car before you go into the arena every time. In preparation for active shooter is top of the line. But yeah, guys, I've done giveaways for a virtual clinical observation program. And those of you who have won my kits, I sit down with you for 30 minutes and we go over how to use a tourniquet, how to take care of an active shooter situation. It's the real deal, and it's there. And you guys are in the thick of it, especially if you're in school. So learn how to use a tourniquet.
So Gil, there's still 300 people listening to you.
Thanks,
isn't
guys.
there a course about how to stop bleeding? You know about that course? Stop bleeding. What is it?
Yeah, there's something called Stop the Bleed and different iterations of it. These are freely available. Take a course in knowing how to package a wound and also how to use a tourniquet. Additionally, my group at UT Southwestern developed its own bleeding control group. It's called the Campus Emergency and Preparedness Survival Training. And we do training for schools, etc. So guys, do please take a course like Stop the Bleed, for example. Those are free.
So at the games, is it just emergency physicians or can other specialties also do this?
Yeah, you get that whole line where that whole row where Shetty's sitting at, that's full of docs. So you're going to have emergency medicine and airway. The head physician is always going to be there. So you see Dr. Demeth. Sitting next to Dr. Demeth, you have the orthopedic surgeon, Dr. Robertson. There he is. And actually, if you don't know, one of the coolest things is one of my med school classmates, Jesse Evan, is actually now, hey, there's my man right there. You have oral maxillofacial right there and dental. So Jesse Evan is now a spine surgeon, orthopedics, who's one of the team physicians. And when I ran into him the first time about a year and a half ago at the game, it was absolutely amazing to see other of your medical school colleagues achieving great heights. So yeah, you get quite a few of us.
So with athletes and celebrities, it seems like it would be kind of hard to also stay within the boundaries of HIPAA. How do you deal with that? And, talking to news outlets, how do you know how much info to give?
Yeah, phenomenal question. As we mentioned before, we try to do everything discreetly, and these are patients, and confidentiality rules do apply. When folks are in the spotlight, the organization has specific rules that they live by and that the players live by in the interest of public safety. Remember that when Rich Beverly goes down, you have his family members who are watching the game and something bad just happened. But you also have thousands of fans who are wondering what is happening with the player. They're obviously scared. That's our airway equipment right there, by the way, guys. That's what it looks like. We got our defibrillator right there. That bag underneath is going to carry all our oxygen equipment. And then to the right, that Pelican case, that yellow one, that contains our airway equipment, contains our drugs, scalpels, our laryngoscopes, and we check that bag ad nauseum. We also have tourniquets in there as well, and pharmacology for airway. Oh, and Dr. Marchetti just dropped that thing. That's okay though. And so, so in the interest of public safety, the organization allows for some freedoms. So for example, when he went down, Rich Beverly gave his permission and had the team president's blessing to give a press conference. And by the way, that's a quick funny story. Rich has been taken to the hospital. I'm walking back, and there is Jim Lights, the president of the team. There's Dr. Robertson, who you guys saw a little bit ago, and they're talking amongst each other. I pull in, and Jim Lights says, all right, guys, it's time to let's get a press conference going. I said, okay. Bill Robertson looks at me, and I look at him. Bill Robertson goes, I think Gil is probably kind of the one that knows the most about this. I'm like, oh, okay. So I said, okay, all right. I'm led into the press room. I've never been to the press room before. Okay. There is no less than 40 reporters and cameras on. I had media training, guys. Nothing would have ever prepared me to be on ESPN, major news outlets. But the pleasure of my lifetime was the first question that I got from a reporter was from George Riba, who happened to be a reporter and married to the daughter of one of our neighbors across the street growing up. So I knew George Riba since I was a kid. I idolized George Riba. I knew who he was. The first time I met him as a kid, he introduced himself as George. And for the first question for me as a Dallas Stars team physician addressing the national media to be from George Riba, heaven, just like meeting Eddie Vedder, getting a question from George Riba was amazing. So that's also on YouTube, by the way. You can get a good laugh out of it.
Gil, when he called on you, Gil, when he called on you, did you sing a Pearl Jam song for him?
Yeah, I should have. I was so nervous trying to pick the right words, because people are going to focus on you, every word that you say. So thankfully it went okay. But guys, I was sweating bullets. I probably showed it too. I think I looked calm, but I was pretty nervous. I won't lie to you.
So where did you get your media training from? Do all doctors and health professionals get that, or was that something that you had to take in order to have that job?
It was part of my fellowship. And actually the man who delivered that lecture was my great friend, former boss and mentor, Paul Pepe, who is absolutely phenomenal in front of the camera. And I learned a lot from him in terms of how do you approach it? What do you say? How much do you say? What are words you don't say? Even things like where do you put a but, a B-U-T, matter a lot. Okay, explaining things, doing it in layperson terms. Had I not had that training, I would have been a mess. I can't even imagine. Just when I saw the word ESPN on one of the cameras, I was like, oh man, all right, I'm very glad I had some training. Yeah, so it was part of my fellowship training.
Gotcha. I feel like that should be standard, but okay, so I've heard that burnout and early retirement is especially common in emergency medicine, especially with chronically unreliable work schedule. Can you comment on this from your perspective and how you remain resilient to the stress?
I will share something that I hope comes out as profound. There is one person that I aim to be in life, and he's the man right there, Ray Fowler. I don't know how Ray Fowler is doing this for as long as he has, but I think I know the secret. Taking care of others like you do yourself, in terms of selflessness, dedication to your team and to others. I think that's the key to longevity. So Ray serves patients like he does his own family, and he treats people like me like family. And I think when you get to work with people that you absolutely love and you adore, then your job is your resilience goes way up. So I aim to emulate the things that other people do well. And and Ray, I don't mean to make your head bigger, but you're so remarkable. You're so freaking good at kind of managing and having equilibrium in your life and balance in clinical, in work, and your personal life, man, you got it all. So if I can master that, then I could probably go till race age. Maybe not that long, because I do want to do other fun things in life later, but man, what an accomplishment. So
Well, the key to that, I think the long-term key is developing relationships. The people you work with, your staff, your fellow physicians, are your friends and colleagues, and that's exceptionally important. And then the other piece is to take real, genuine interest in the patients that you serve. I mean, really be interested in them, because that keeps feeding back strength, to you, don't you think, Gil?
100%. The taking care of other folks and getting a thank you at the end of the day, to me, is far more important than just making the right diagnosis. For example, I'll take a thank you any day, or a nice letter from a patient about how kind and the professionalism they were treated with, than having a good save, for example. I'll take that any day.
All right, I think this is our last question. So you said that you live and breathe for hockey, but have you ever done any other events, like somebody asked extreme motorsports, or have you worked with dancers or swim meets? Do you do any other sports?
Yeah, I volunteered my time with football, particularly high school football, and I find that athlete population to be just, a lot of them are pre-meds, for example, pre-health, pre-PAs, and it's been awesome to interface with them. I've done some work in boxing in the past, and that's been absolutely phenomenal. Totally different kind of athlete population, whole different set of expectations, and just brave, just absolutely brave. Done some work with UFC before, done some professional basketball in the past. But guys, I'll tell you what, to me, nothing beats the personality of hockey players. They're just really good guys. Brendan, what do you think, man, about athletes overall? Do you have any preference, any insights?
I'm a big college sports fan. Growing up in Arkansas, we didn't have any professional teams, so the Arkansas Razorbacks were our professional team. So I've done a lot of college football sidelines. Love it. I'm not a big hockey fan. Growing up in the South, never watched it until I worked my first game, and I don't like being cold, so there's that. But you're right. They are some very, very kind and grateful players. So.
Yeah, it's amazing. It's absolutely amazing. Well, guys, that is the end of my talk. I just want to thank Dr. Fowler, Reagan, the rest of the team, Brendan Rochetti for jumping on. Elaine, thank you so much. Guys, this is all on a volunteer basis for us. Somebody asked the other day, why do I charge for VCOP? Not a penny goes to my pocket. It's all to pay for the learning platform, so you guys can pronounce certificates and look at the recordings, etc., to pay for registration and customer service, to give scholarships and for education. So all of us here tonight are doing this because we want to give back to our communities and inspire you guys. So let us know how we're doing, and we're hoping to see you on May 6th for virtual clinical observation program. This episode is going to be themed severe disease and severe injuries. You're definitely not going to want to miss that. We're going to have a PA who's going to co-host that with us. So we look forward to having you there. All information and registration links in my bio on Instagram.
Yay, VCOP. Can you go to the next slide, please? And we will also post all of the VCOP stuff on the virtual shadowing story on Instagram too. So if you missed it here, you can catch it on our Instagram. And this is the quiz 46 QR code. So just scan that with your phone, and that will take you directly to the quiz. I think it's 9 questions this time, and it's due next Tuesday at 6:59 p.m. Central Time. It will also be posted to our Instagram and our website, and Rachel will send out in our emails. So I think that's it. We will definitely reschedule Crystal for next week. That's on Wednesday at 7 p.m. Central Time. So next week we have 2 sessions, which is super exciting. So we hope to catch you then.
Well, we want to thank everybody for coming, and we're going to be here as long as you keep coming back. So on behalf of the whole virtual shadowing team, the wonderful Dr. Salazar, who's the most flattering person I know, who was so gracious to pitch in tonight, we want to thank you all for coming, and we wish you a good evening and a good night. Good night.
Bye, guys.